Okay guys, so in this video we're going to go through instability of the shoulder joint and the tests that you would use for that. Obviously you want to test for anterior instability, posterior instability and inferior instability. You could have someone that's got multi-directional instability and you need to make sure, and it's important that you test both sides, the symptomatic side and the asymptomatic side, because if someone is hypermobile or very flexible, then you may well find that they may seem positive, but it may well be a false positive because they're just generally flexible in their joints. So what we're going to do, myself and Glenn, is just go through in a second with you the different types of tests that you can use for those types of instability. Okay guys, so in this video we're going to go through a load and shift test for the shoulder to look for anterior instability. So Glenn, how would we do that?
So we've got Patrick sitting on the edge of the couch. First thing that you need to do is get your hands in the right position. So I'm going to come onto the acromion here and the lateral spine of the scapula, and that's my benchmark. I'm now going to locate the head of the humerus. Okay, and then that's not too bad. Actually, in an ideal world it should be sitting centered in between those 2 points. You can see with Patrick here, he's just ever so slightly anterior. What I'm going to do now, I'm going to provide a slight compression and then I'm going to shift anteriorly. Okay, and that's quite a nice result there for Patrick. If I can get more than a third of the humeral head anterior of my front finger, then I would classify that as an anterior instability. Yeah, so you saw there with Patrick, we weren't anywhere near a third, so he wouldn't be classified as anteriorly unstable, which is good. But that is your load and shift test.
Okay, so the next test we're going to do is for inferior instability of the glenohumeral joint, which is a sulcus test. So Glenn, how do we do that?
So again, we've got Patrick in this sitting position. We're going to locate the joint line, so we're looking for the glenohumeral joint line. And then once I've found that, I'm going to provide a inferior distraction on the glenohumeral joint. And I'm looking at two things. So do I see a sulcus? As the name of the test suggests, that would be positive and that would suggest inferior instability. But as Patrick's got a little bit more muscle around the shoulder area, you might not see that. So do I feel a sulcus sign as well? And what I would look for is anything greater than my finger width would be positive for that. Yeah. So in a very obvious client, you would see a very pronounced sulcus, but more subtly sometimes you can more feel it. Yeah. So that's your sulcus sign for inferior instability.
And sulcus just being essentially like a gap, like almost like a little valley. That
exactly, it's exactly like a little divot, a little valley that appears in the joint line, and you can actually see the humeral head migrating inferiorly.
Perfect. Okay guys, so in this video we're going to go through a posterior apprehension test or a posterior instability test for the glenohumeral joint. So Glenn, how do we go about that?
So yeah, this is inferior apprehension test, the same as your anterior apprehension test that we went through in another video. So it's really important that you're looking at your client's face and getting feedback from them the whole time. You bring the arm up into flexion, about 90 degrees of flexion, yeah, in the scapular plane, and then we are going to create an axial load. But before we do that, I'm just going to support his scapula. I like to get my hand underneath here to give a little bit of support. I can then use my body to bring in some horizontal adduction, and then I can put the axial load in, and then I'm going to medially rotate when I'm in that position. Yeah. Another way you can do it, you can load first, and then you can bring it across and medially rotate there. Now, obviously, while I'm doing that, each component I'm going to be asking Patrick if he's okay. I'm going to be looking at his face for apprehension. You can also get pain provocation with this test, which would also be a positive test as well. And that's your test for posterior instability.
And I think with all these tests as well, it's important that you, like Glenn was just saying, that you're always assessing how the patient's feeling and looking at how they're, responding. Because, apprehension tests in and of themselves, or instability tests, you're taking someone to the point of, essentially a dislocation. So if they are unstable, you don't want to cause them a dislocation. So you want to be really careful with these sorts of tests and really looking for pain provocation. If they're getting pain, then do stop, because I think a lot of these things can be quite risky tests when you do that.
Exactly. I mean, I know some of the orthopaedic consultants, these tests used to be called relocation tests, didn't they? So they would actually dislocate and then relocate, and I think as physios that's certainly not what I'm trying to do. So you want to make sure you avoid that at all costs.
Yeah, absolutely.